thank you again for being here.
No problem.
And you probably do know the panel, my colleagues here, who've been tremendous this afternoon, dealing with the theme that's looking at health and wealth specifically. We've had a fantastic discussion this morning on the theme of quality of healthcare and the enablers of integration. So it's mostly about health and wealth, and we've had a number of people who've really been very frank, very open, what the Commission could do in improving London's health and wealth agenda, and including Elliot, who was here earlier, and shared with us some of the exciting work he's doing with the 4 gaps that he's clearly identified and what we can help him with. And so I really wanted to get your thoughts about, what could this Commission do in terms of the economy and the economic growth as a whole, not necessarily just health, but what could health or this sector do in all aspects of London's economy, if that's something we can contribute to?
Well, thank you. I'm glad that you're focusing on this, and not least because I've obviously got some challenging targets to hit. I mean, I think there are a number of levels where the industry, if you like, for want of a better word, can contribute, and they obviously range from the micro level, like we could do with more apprentices in health, and there being a wider pool of opportunity, if you like, to enter the health service, and, if you like, greater permeability in the health service in particular, but the health industry generally, to government and other parts of the government other than the health service. So the challenge has always been, how do you penetrate the National Health Service? How do you get in there and promote the apprenticeship program? I mean, in my previous job, how do you talk to them about crime and how they could assist on crime? And so there's that kind of day-to-day level where they could help, and then it ranges right the way through both the public and the private sector in health, right up to the kind of macro level, where, as Elliot will have told you, we're trying to position health and life sciences in general in London as a kind of twin industry to financial services. And along that continuum, there's a huge amount that can be done. Obviously, it provides opportunities for us both in terms of internal employment. That's the critical thing for me, really, is about it being a big industry that employs lots of people. But also it's a massive export opportunity for us as well. So not just drugs and drug discovery and all that kind of stuff, but obviously the private health sector makes a big contribution in terms of overseas earnings. We have I used to live in Marylebone and was endlessly giving directions to Harley Street and Wigmore Street and Wimpole Street to people from all over the world. The United Nations seems to come, including several dictators, seem to come and get their problems sorted out in London. So there's a huge amount that can be done. And to be honest with you, that's why we identified life sciences within the overall science bracket as an area that was ripe for exploitation, because from an economic point of view, because while we all know, as well I do now, but you as professionals or people who've been involved will know that there is a big health and life sciences sector in London, nobody else does. If you ask your average Londoner to identify the industries in London, I think health or life sciences would not figure in their top 10. If you talk to people around the world, particularly non-life sciences business people, they would not identify London as a global pole for medical research. They might for a bit of health tourism, but that's it, really. So on all levels, I think there's a huge amount of potential there.
Thank you. Thank you for that. It's interesting what you touched on, because the taxonomy is also very important, the language, because the life sciences, when we talk about that within the context of London, I think most of us are talking about medtech and pharmaceuticals. We don't really talk about the concept of health tourism that you made a reference to.
Yeah.
And there's plenty of evidence that, in actual fact, we've lost ground on that since the 1970s for all sorts of reasons. And that's about a $100 billion industry. Yes. At the moment, and our share of that is very small. Yeah. Singapore, for example, has grown by multipliers in Asia, and providing a...
Yeah, it doesn't surprise me. And there are other ancillary. I mean, we have a cluster of medical publishers on the Euston Road.
Yes.
Basically all the major medical publishers are here
Yeah.
in London. That's a big industry too. And ancillary to that, I mean, at London and Partners, which I chair, we also have a conference bureau, which is largely taken up with enticing medical conferences to come
Yes.
to London. So in 2015, we have the Cardiologist, which is the
Yes.
biggest one, I think, in the world. And the estimates are that's worth about 120 million to the city.
Yeah.
So, there's all sorts of benefits to having a good, strong health industry in its widest sense in London.
So look at wider than look at health tourism, look at medical.
It's not just about drug
health
discovery.
events.
It's about all that stuff. And frankly, even some of the interaction with other growing areas of expertise. So if you look at the tech city growth, the London's position in computer science, as that moves away from a kind of consumer-facing apps type industry towards more of the heavy-end big data, diagnostic, all that kind of stuff. Have we got something in London that could add to that? To add to the mix on life sciences too, because you're dealing with a huge amount of data. And obviously, I've seen endless proposals for iPads for doctors, for instance. Right, there seem to be dozens of people who have. Every doctor in the NHS should be carrying one of these iPads. Well, if one of them was invented in London or the software is in London, then it's a great export for us too. So there's all sorts of things that come out of it.
Yeah, thank you. I think one person earlier suggested, if I could just ask one last question, is probably we should do an infrastructure review, because if you're going to really talk about big data, and we should have an infrastructure review when it comes to the life sciences. Have you put any thoughts to that, or do you think?
Yes, I mean we generally need to map what we have in London anyway.
Yeah.
Obviously, our two partners in the MedCity proposal, Oxford and Cambridge, have already done that.
Yeah.
And so, just funny enough, last week we approved the funding to do a similar mapping exercise. Right. So the whole triangle will be mapped in terms of what we got. Yeah. And part of that will be about the infrastructure that's available. I mean, anecdotally, I'm told on my various tours and visits that there is an infrastructure problem in a particular part of the life cycle of medical companies and life sciences companies in particular. But mapping that would be great. I mean, the other thing is, I think, the big word in life sciences at the moment in medical seems to be the C word, but it's collaboration, not cancer, right? And we seem to, it may be that we have all the infrastructure we need, it's just not everybody knows about it. And I gather that there isn't a culture of sharing, of playing nice, and sharing equipment that may be used and infrastructure that may be used rarely but is vital to particular parts of research. Absolutely. So having a compendium, if you like, of what's available, I think will be useful, and we hope to do that over the next couple of months.
Fantastic. Thank you. Paul. Well, Peter, sorry.
Kit, thank you. I mean, the ambition is fabulous here. Just if you could share some insights as to where else in the world should we be looking to perhaps learn from, not as a perfect example, but where they're doing some bits well. I mean, earlier on today we heard Elliot talking about the lack of a common identity here, rather than it being Boston per se. We've also heard about the lack of join up when we are a great financial city, and yet it's very difficult for small businesses and startups and biotechs to get funding.
Yeah.
Your insight, please.
Well, he will have filled you in on exactly the issues, which are we in many ways we have all the cogs of the machine. We just haven't fitted them together properly. And there are some areas of the world, you're quite right, where they do. So if London, we have a problem, or the UK generally, we have a problem with risk capital. They seem to do that remarkably well in Boston and in the Bay. We don't really market ourselves very well as a health city, if you like, or a life sciences city, whereas you look at a relatively small city like Vienna, and they seem to do that remarkably well, even though their sector is nowhere near as good as ours. Similarly, as you said, Singapore have identified that there's a big market for them in their surrounding neighbours, and so they're pushing it hard and diverting traffic that will otherwise come to us. So, I think you're absolutely right. We have to pick and choose from different areas and cities and not be too London about it and say everything is made here and there are no ideas from elsewhere. And frankly, while we do in the Triangle have Europe's 1 and 2 in terms of pharmaceutical companies in AZ and GSK, we need some of those huge international conglomerates to come in and help us build the cluster, because fundamentally they've got the staying power, the money, the research background, the pull with international governments, all that kind of stuff that's required. So, we can't attract them to the exclusion of elsewhere, but we can make it a very fertile area for them to come by piecing, as I say, together those cogs of the wheel. And they are broadly about, say, making the thing work, opening the NHS up to research, to the private sector, opening up our academic health science centres, which are expanding in a way they haven't done in the past, up to the private sector. I mean, that's happening. It's, private money is less of a dirty word in academia now than it was, but there's still some resistance there. Getting those universities to work together, the 5 of them, 6 of them, 7 of them, however many want to work together, so that then they drop the "you can't see my homework" approach, which they seem to have had thus far. And then, critically, while we do okay on spin-outs, we don't do brilliantly well, getting the risk capital in and to look at life sciences and health as an asset class that is sort of underdeveloped is critical. To me, that's the big collaboration. That's really what we can learn. And I think we can learn the most from Boston on that, is we have this big wall of cash at one end of the city. We've got a big wall of research at the other end of the city and in the universities that surround us. The two just aren't connecting in a meaningful way. And I think that would be the big unlocking thing that we can learn from someone like Boston. And we've had a couple of sessions with people from Boston to say, how does it... I mean, it seems to be almost accidental, right? In Boston. It sort of happened by accident. They didn't set out to do it. But now they've got the momentum rolling, a bit like Tech City in London. They're doing their bit to kind of keep the flywheel on, and that's the position we need to get to.
And getting the government infrastructure or the local government infrastructure to support it. You mentioned cardiology. If you look at the Midwest, Minnesota and St. Paul, 95% of the big cardiac equipment people are based in those 3 cities.
Yeah.
And, they get very well supported by local economic enterprise.
Yeah, I think that's right, and I think there are some local authorities here that are very supportive. I mean, you go down to Sutton around the Royal Marsden, they have a life sciences strategy of their own. They really want to support that and grow it. Camden, similarly, in and around the Crick and the Euston Road corridor, and the bioscience incubator at the vets, the Royal Veterinary College. They're very supportive, but it's not universal. And part of the mission will be to, as I say, for the support for the industry in London to be as strong as it is. Well, I say strong in inverted commas for financial services, right? Because we have a love-hate relationship with that industry.
Thank you.
Good. Two things, Kit. They're slightly separate. So the first one's, we've had lots of warm words this afternoon from everyone, both sides of the panel. But I'd like to hear from you, really. Are there some practical things that we could do that would make these warm words be more likely to convert it into kind of action and meaningful initiatives? And the second thing is slightly different, which is, one of the other kind of briefs of this bit is about education. And Aaron, you were talking earlier about how we've slipped a bit in terms of attracting people from overseas, both as patients but maybe as researchers. And what your thoughts were about how we might make it a more attractive place for people earlier in their careers to come to train and then kind of spread the word about us, and also we could cream off some of the talent. So those 2 questions. Yeah,
I mean, just the second one first. Obviously one of the remits of London and Partners is to get as many students and researchers and people in academic institutions here. And as we see, the Crick coming on stream is going to require 1,500 people at varying levels, but there'll always be a bulge, if you like, at the lower levels, certainly from an economic point of view. And the big problem there, saying to us, is actually a problem that's faced, I think, throughout the health industry, is about housing. People in this industry, unless they're, Andrew Whitty, aren't paid a huge amount of money. Once you've done, a decade or so of slogging away with your scalpel or whatever it might be, then the triangle is pretty sharp. But there are some who can afford to live in SW3, not many. And that's why there historically have always been nurses' lodgings and junior doctors' lodgings and all that kind of stuff. And so we're very focused on that if we want to attract the research base, we need somewhere for junior researchers to live. And so we have had some initial meetings with the academic institutions and with housing providers to talk about possibly providing some kind of specialist housing, because that seems to be the critical bit of the catalyst that's required. People are put off coming purely because of the housing cost. And so hopefully that will come to some kind of fruition and will help us, as I say, push the education thing, the research base forward. I mean, the theory is that if we have a strong research base, the rest will come. Because what we don't necessarily want is to create a strong industry that's just for higher graduates, right? Because generally they're going to get jobs anyway. Even in London, they'll get jobs anyway. The real issue is we want the ancillary stuff that comes alongside, and the ideal, frankly, would be to get to a Swiss situation where we've got fairly large-scale manufacturing here, not least as there seems to be a general move back towards quality, if you like. So, whether you want your drugs manufactured off in the middle of nowhere, I don't mean to be rude, but you want somewhere that's fairly heavily regulated. If you're going to inject something into you, you want some assurance that it's been made to a high standard. So having a strong research base is critical, and what seems to be the key thing to that seems to be housing. We don't seem to have a problem with academic expansion. They seem to have lots of ambition and funding and support at the moment to do that. So attracting them in, I think, will be great. And then practical things, it's a really tricky one about that. I mean, part of our mapping process is to look at what we can practically do and therefore give recommendations to other bodies about what they can practically do. I have anecdotal things that people have said to me that could be done. So, I mean, the thing I said earlier on about putting pressure on the health service to open up to clinical trials, to the private sector, to joint ventures, to all that kind of stuff, allowing a culture where academics in particular can move in and out of the private sector and academia like they do elsewhere. I mean, there are some that do it in Cambridge and elsewhere, but it's not an accepted thing. You kind of leave and it doesn't really work. So there's stuff like that. And then the other one that I'm increasingly interested in now is looking to Europe for funding, because there's obviously a wall of funding for this kind of thing in Europe, not least for big infrastructure projects. Is there some kind of institute or some kind of thing that we could have in the southeast of the UK that we could do that nobody else could do along the lines of the Crick? These are the, if you like, the foundation stones of an industry. I mean, the Silicon Valley was basically built from IP coming out of Stanford, right? That's where it started. And so if you've got these institutes that can sit at the bottom of an industry, then they make a big difference. So if we can attract them and European funding for them, I mean, we had discussions just last week. Could we bid for, is it possible to put together a consortium for a dementia institute in London? We have departments looking at it and particular professorial teams looking at it, but there's no, a bit like we have the School of Tropical Medicine, right? There's no School of Dementia. Now, could we put something together that would then attract European funding, not least because it's going to bust their economies in the next 30 or 40 years, same as it will ours. So there's those kind of areas that I think we could, as we form up London's requirements at the various levels, that you might be able to help us with.
Okay. Great. Thank you. David?
Hi, Kit. Can I just follow up on a comment that you made which resonated a lot with me? You said that you met people in Harley Street and Marylebone that understood that there was a health, that health was important in London. And it really made me think during the rest of your talk, because if you go to Boston, people don't understand that's what's underpinning the city's economy. It's not difficult. And you made this comment which I thought was so perceptive. You'd realise that in Marylebone, you wouldn't realise it in Dagenham, say.
No.
Not for a moment.
No.
And maybe I was reflecting, maybe this is quite a big weakness because we have focused, and it's a question, we focused on specialist centres and you bring together the health and the university, and that's often very productive, particularly around first-in-man type research. But of course, if the population don't see it, that's what the business is stupid, it isn't where the bright people go. They go into finance. We've got 8 million people. There are way enough bright people to service the needs, but we don't attract them into this sector. And recently we've been looking at developing a schools network, a research schools network. You get tremendous resonance. We've got 200 schools signing up across north-east, north-central London, as though that was a virgin territory. And I'm just was reflecting on how much we should see this in terms of wanting to actually spread out more across London. We've tended to focus very much in on bringing researchers and healthcare together. But I wondered how much we should be looking to have this spread out more across the Dagenhams and so on, particularly on the bioinformatics platforms, because unless population think this is the business, as they do in Boston, the bright population don't go into it.
I think that's exactly right. I mean, I think there are two levels, as I say. Yeah, I think you're quite right. Financial services sucks up too many good brains to do jobs that could be done by, I'm in financial services, right? That could be done by average brains. And it's the lure of filthy lucre and all the rest of it. And I guess it would be helpful for us, one, to spread the idea that there is this industry in London, because there are no better ambassadors for London than Londoners who travel across the world, all the rest of it. So if everybody saw us as a health city as much as a financial services city, that would be great for us overall. But secondly, I think having some kind of schools network around research would be fantastic in terms of inspiring the young people of the future to go into the industry as it grows, because the other break on it will be, frankly, the ability to access skills. So if we do get a large foreign direct investor that wants to come in and do some manufacturing here, if they can't find the skills that they need, whether that's research or technicians or whatever it might be, then they're not going to come, no matter what the incentives are, if they can't stop their thing. So the two would come together pretty neatly. But then in terms of spreading it further, I do think it's important. I mean, the theory is, as I said before, that if we can build a really strong research base, we can move beyond just the administrative headquarters being here of AZ or GSK, but actually have a ring of manufacturing around London. I mean, it's never going to be in Zone 1, right? But it'd be nice to think that next to Ford Dagenham there might be some kind of manufacturing plant that goes there, driven by the market, not by a government handout or a subsidy or whatever it might be, that actually, whoever it might be, Merck or someone like that, decide to come and make their latest thing at a plant, same as the car industry has. And so, as I say, the biggest area of concern for me in employment is youth unemployment. It's young, non-higher graduates, 18 to 25, where London has a bulge. Now, I'm not going to solve their problem this way in the next 2 or 3 years, but in 20 years' time, then we might be able to, if we start to put these building blocks in place now. But part of it, I think you're absolutely right, is about trying to switch the psychology of the city. They've switched on a bit to digital and tech. So the tech city phenomenon has got a bit of a hold. I think if you ask sort of younger people coming up through the system in London, they would know about tech city much more, largely because they're on social networking in a way I'm not, but much more than they would about health. And that's a pity, really.
If I just pushed on that a bit, though, there was a report recently that speculated there would be a shortfall of health informatics support staff of 200,000 across America in a few years' time. And, I guess if you ask the average Londoner about is health informatics something you want to train in, they'd look at you as though you'd come from Planet Zog or something.
That's right.
So I think but they wouldn't think that if you were in Boston, Cambridge or Oxford probably. And so I think your point was so on the money about
I think you're right. I think you need to get into 7, 8 and 9-year-olds and explain to them what's exciting about the industry. I mean, look, I've always been a bit of an amateur, get new scientists and all that kind of stuff. I was never talented enough to do it, so I'm interested anyway, but I find it completely fascinating, and so do my 15-year-old does too. He won't be doing sciences either, he hasn't quite got there. Fortunately, there is a genetic element, I'm afraid, that means he won't either have the talent. But yeah, I think if you can inspire younger people that way, then they will not least make themselves available, at least for the jobs that come forward. I mean, there are, funnily enough, we're doing some work at the moment. I mean, it's sort of the other end of the scurvy light. But one of the issues we've got with our apprenticeship scheme at the moment is that young people won't go into the hospitality industry because they have a misperception about what it involves. They think they're going to be washing up. And they don't realise that, while you might start in a kitchen, there is a career path that could take you internationally, be manager of some huge hotel, all that kind of stuff. And so we will be embarking in the next few months on an education process around the hospitality industry, because there's 60,000 jobs available there for young people that could be taken, and that actually are largely being taken by people from overseas at the moment. So changing the perception around it and exciting young people around it, I think, will be part of it, because, as you say, if this is a 30 or 40-year project, we need the fodder to come out every June.
Very helpful. Thank you very much.
It's great. I think healthcare needs a hospitality service as well.
Well, this is it. I keep telling them they're a derivative industry.
Yeah.
If we have a fantastic life sciences industry, then the hotels will be full.
Yeah.
That's why they're so keen on all the conferences and all the rest of it. Yeah. I said, you want, financial services is sort of 2/3 filling many of the hotels at the moment, and retail. The other third could be filled by the health service.
Okay. So, just to finish off, you've seen what advice do you have? What else do you think we should be doing in terms? What's in your bigger picture? What do you want to get out of this health commission that we haven't covered?
It's a very good. I wish you'd asked me to think about that before. It's a very difficult job that we're at, right? Because it strikes me that life science is a bit like you've got to see the city a bit like a fish tank, right? So you're putting all these tropical fish and all these different creatures in and all the rest of it, but actually the environment is incredibly sensitive. And it only takes 1 or 2 little drops of something that you didn't expect, or you get a bit of bleach on your hand and you wipe the fish out, right? So getting the environment right is a very delicate kind of chemical balance. And there are all sorts of influences on it. There are some big ones, though, for me, and anything you can do to help on those would be great. One is, as I say, risk capital. I think that's to continue my now, and I'm now trapped in this metaphor, right? To continue my fish tank thing, that's the oxygenator in the corner that's putting oxygen in the water. So risk capital is absolutely critical, and anything you can do, advise, help to free up risk capital. And that might be, actually, around the macro economic environment around risk capital in this industry. I said to other forums that investing my own money in life sciences is effectively quasi-charitable giving. Right? 9 times out of 10, I'm going to lose it. And even if I don't lose it, I'm probably going to have to wait 10 or 12 years before I know. Well, to my mind, that's charitable giving. And so whether the tax environment is commensurate with that, I don't know. I mean, if I give to a charity, I get 100% tax relief, right? But not if I give to a drug discovery company. So there's some stuff around that, lobbying, patent life, all those kind of things that will help, I think. As far as you're concerned, I think the most immediate thing, and I guess this is where most of your focus of your work will be around the operation of the health service and what the health service can do. And I think the critical thing there is that permeability. I mean, the Prime Minister put his finger on it. I think I said to you, Ara, when we met, every patient a research patient. Yep. If we can make that real in London, then that's the other bit of the cocktail that people will come for. Yep. Because we have every genome type here. You don't have to travel the world. You'll find a much more varied population than you will in Frankfurt or Geneva or anywhere else you want to do your clinical trial. So you can hit the sweet spot here. So opening up from a research point of view on that. And then, as I said, again, encouraging academic collaboration. I mean, we're trying our best to sit within the triangle as an Oxford, Cambridge, London thing. I'm not quite sure Oxford and Cambridge are totally convinced yet, but we're doing our best to play fair and not be Fortress London. So drawing them in as centres of health excellence would be critical, I think. I don't know if they're coming to see you or talk about how they interact with London or but obviously they have specialist services, whether it's the Papworth and the John Radcliffe, all the rest of it, that we access, and they often access our services here in London. So talking to them too, I think, would be key. Yeah. Anything about estate or NHS estate? Well, yes. Economy? Well, if you want to ask a question about that, absolutely. I don't understand why the NHS has to sell its estate on the open market. For me, we're missing a massive opportunity if we're losing valuable estate next to hospitals that could go to research institutions or even to private drug companies. I mean, if you look at the Queen Mary situation at the moment, there we have health land that could, please God it doesn't, in theory go to the private sector for yet more flats to sell to the Far East. whereas in fact we could have a fantastic health campus there. Similarly, in the Whittington, there's a big fuss at the moment about much of that site being sold. Locals are all campaigning against it. How much easier would it be if it was being sold as a dementia institute for London?
Sure.
So I think treating the health service and its assets differently from everybody else might be helpful too.
Okay. Well, we've taken enough of your time. Thank you very much for your time.
Thank you.
I know how
Pleasure.
busy you are, and
No, it's a pleasure.
thanks. We'll keep in touch with you and maybe
Yeah,
share
absolutely.
some ideas and thoughts.
No,
in
well,
it.
yeah, once we're up and running, call us
Yeah.
back and we'll
we'll
come
do
to
that.
how it's going.
We'll do that. Thank you.
Thank you.
Thanks very much. Thank you.